Hello, everyone. Welcome to the Health, Hospitals, and Social Services Committee meeting on Tuesday, February 2nd, 2021. Want to start off with a motion for electronic meetings, and we will use this as our attendance meter as well. Pursuant to Governor Lee's Executive Order number 71 regarding electronic meetings, I make a motion that this committee meeting agenda constitutes essential business of the Metropolitan Council, and that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in light of the COVID-19 outbreak. Do I have a second?
Second.
All right. It's been probably seconded. Councilmember Hurt.
Aye.
Councilmember Benedict.
Aye.
Councilmember Glover.
Aye.
Councilmember Hall. Councilmember Porterfield.
Aye.
Councilmember Pulley.
Aye.
Councilmember Welsh.
Aye.
Councilmember Hauser.
Aye.
And I, Councilmember Taylor. Great. So today, I sent a note to you all. We have a special guest. We're going to handle the business first. We're going to take up our business first, and then our guest will be Miss Mary Falls from the mayor's office. She's going to discuss with us information on J.B. Knowles' home. And so wanted to bring that to you guys so we could be, again, working the spirit of transparency that we set at the beginning of this term to get as much information shared with this committee on things that are happening in the community that relates to our committee. So RS 2021-741 by Toombs, Taylor, and Allen approves a subrecipient grant agreement between the Metro Development and Housing Agency and the Metro Department of Social Services for one-time payments of first month's rent and security utility deposits on behalf of homeless persons obtaining housing through various campaigns.
Move.
Do we have a second?
Second. Second.
Yeah. It's been moved and properly seconded. Do we have any discussion? All right. We'll do a roll call vote. Councilmember Hurt. Councilmember Benedict.
Aye.
Councilmember Glover.
Aye.
Councilmember Hall. Councilmember Porterfield.
Did you say Porterfield, Councilman Taylor?
Yes, ma'am.
Porterfield votes aye.
All right. Councilmember Pulley.
Aye.
Councilmember Welsh.
Aye.
Councilmember Hauser.
Aye.
And I vote in the affirmative as well. Motion carries 8 in favor, 0 against. We have a late filed resolution by Councilmember Swara. Is Councilmember Swara in the meeting, if she is?
Yes, Chair, I'm here.
Perfect. Thank you, Councilmember Swara. So we have a late filed resolution by Councilmember Swara, a resolution approving mayoral conditional approval of acceptance of a local government emergency rental assistance grant from the U.S. Department of the Treasury to the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Action Commission to be used for emergency rental assistance in accord with the purposes set forth in Section 501 of Davidson Division N of the Consolidated Appropriations Act 2021. Do I have a motion?
Move.
Second.
All right, it's been moved and seconded. Councilmember Swara, you have the floor.
Thank you, Chair. This resolution is approving a grant that we have of 20.8 million to be able to help our citizens that are in dire need with the mortgage and rental assistance. I have the honor of also serving on the board of the Metro Action Commission, and I can vouch that the agency is able and ready to take this on, and we really do need to do this. It was late filed because the grant is time sensitive, and we need to get going so that our citizens can get the help that they need, especially those that are very, very in need, our low-income residents. So that's what the resolution is about. I believe Director Krum is also on the line and can provide more information if anyone has a question. And I ask that you all approve it. Thank you.
Thank you, Councilmember Suara. I believe we have Dr. Krum on the line.
Hi, just for point of clarity, hi, good afternoon to everyone. It is rent only. It is not rent and mortgage. These funds do not cover mortgage. This is rent and utility assistance through these particular dollars.
Perfect.
Thank you.
Thank you so much. Does any committee members have any questions or follow-up? Councilmember Hauser.
Yes, the question I have is how do individuals find out these monies are available?
At the point that we go live with these dollars, we will do outreach to the community, but just so that I can share with you, we've already had preliminary meetings with several groups. We met with the community partners, which is community-based organizations, our nonprofits today. We met with landlords today because what is also different about this funding is that landlords can apply on behalf of their tenants, even though the tenant has to approve. We also are working with the courts for individuals who are on the dockets for evictions to try and see if we can address those arrearages that those individuals have prior to them actually going to court. And then our normal process of media and outreach to customers is what we will also do. So we've already begun the process of working with some of the folks who work with the customers we're trying to reach, but you'll also see a pretty extensive communications plan that will also happen.
And in addition to that, I assume that the purpose of this is to hope to prevent homelessness. But I was wondering, for those landlords who the tenants have disappeared and owe them money, would they be eligible for this, or is this only for when the tenant is still in the housing?
It's only when the tenant is still present in the housing, and the landlord can apply, but the tenant must, it's actually the tenant information that is utilized, so they can apply on behalf of the tenant. Then we reach out to the tenant to make sure that they complete the application process. But no, the tenant cannot be, have moved from the residence and still receive assistance to the landlord.
You're muted.
Councilmember Hauser, is that all you?
Yes, that's everything.
Okay, thank you. Councilmember Benedict.
Sorry, Chair. I'm sorry. You recognizing me?
Yes, I'm recognizing you.
I just was trying to say that you were muted a second ago when you were talking.
Okay, yeah, I saw your hand up.
Oh, I'm sorry. Sorry about that. Thank you.
No problem. Yes, ma'am. All right, good deal. Do we have any further discussion? All right. Great. So we'll do a roll call vote on the late resolution from Councilmember Suara. Councilmember Hurt?
Aye.
Councilmember Benedict?
Aye.
Councilmember Glover?
Aye.
Councilmember Hall? Councilmember Porterfield?
Aye.
Councilmember Pulley?
Aye.
Councilmember Welsh?
Aye.
Councilmember Hauser?
Aye.
And I vote in affirmative as well. Motion carries 8 in favor, 0 against. Our final item on the agenda for this evening is BL 2020-586 by Toombs and others. Amends ordinance number BL 2014-688 to reverse the Metro Council determination that the provision of long-term medical care is obsolete and unnecessary as a governmental function. directing that certain actions be taken regarding the preservation of the licensed beds at the Bordeaux Long-Term Care Facility and appraisals of the Bordeaux Long-Term Care Facility and J.B. Knowles Home for the Aged Facilities, and requesting the creation of a long-term plan for the J.B. Knowles Home Facility. Councilmember Tools, do we have a motion?
Move.
And a second?
Second.
Thank you, Councilmember Toombs. You have the floor.
Thank you, Chair. I do have a substitute. I'd ask that someone on the committee move the substitute and I could provide an explanation.
Welsh moves to substitute.
Second.
Been moved and probably second, Councilmember Toombs.
So the substitute is the result of a lot of conversation with the administration to address some concerns about some of the language. Make some tweaks to the recitals, and then going into the actual meat of the substitute, there was some concern about the language rescinding the 2014 declaration, and there was Director Cooper opined that language wasn't necessary to do the things that I'm looking to do in this bill, which is in the new section 1, once you delete the old section 1. So the new parts in section 1 acknowledge that the Bordeaux Long-Term Care Facility license is already in inactive status, and so it requires that any fees related to maintaining that inactive status be paid out of the operating budget. The new section 2, the new section 3 clarifies what the long-term plan is. So it says that, and who's responsible for it. Section 3 says that the administration will work with the operator of Knowles to submit a 5-year plan to the council within 180 days of the completion of the RFP process with a successful bidder, or within 1 year of the effective date of this ordinance, whichever occurs first. If there's no successful bidder, then the administration shall, within 1 year of the effective date of the ordinance, submit a 1-year plan that includes information required in section 2, which is the appraisal of the value of the Knowles facility, the land, as well as the licensed operators of the assisted living facility. So they include that information as well as a statement regarding whether the administration, A, recommends the cessation of services at Knowles, B, intends to continue to seek a new operator, and if so, it's planned for selection of a new operator, or C, other recommendations for continued operations at the facility site. And so with that, I would ask for the committee's approval.
Thank you, Councilmember Toombs. Councilmember Taylor had to leave, so I will be taking over the meeting. Is there any discussion on the substitute? Looking for hands. Seeing none, would anyone from the administration like to speak to the substitute? We have a proper motion and second on the substitute, so let's take a roll call vote. Councilmember Hurt?
Aye.
Second in April, I'm happy to do that. If he's okay with the first meeting in April, I'm happy to do that. My only concern about...
Oh, thank you. Councilmember Benedict?
Aye.
Councilmember Glover?
Aye.
Councilmember Hall? Not present. Councilmember Porterfield?
Aye.
Councilmember Pulley?
Aye.
Vice Chair votes aye. Councilmember Hauser?
Aye.
And Councilmember Taylor, are you still hanging out a bit?
Yes, I'll have to leave in a few seconds, but aye.
Aye, okay. We have 8 for, 0 against, so the substitute passes. Councilmember Toombs, can we have a motion on the bill as substituted?
I would ask that the committee move the bill as substituted.
I move the bill. I move for it to be moved.
Second.
Thank you. Do we have any discussion on the bill as substituted? Delicia Porterfield, Councilmember Porterfield, do you have a question?
I just wanted to thank the sponsor for her hard work on this. We've seen this tracking for a while now, and I just appreciate the work that she's put in on this. So I ask my colleagues to please support. Thank you.
Thank you. Anyone else? Discussion on the bill as substituted. Seeing none, we will take a roll call vote. Councilmember Hurt.
Aye.
Councilmember Benedict.
Aye.
Councilmember Glover.
Aye.
Councilmember Hall, have you joined us? Councilmember Porterfield.
Aye.
Councilmember Tully.
Aye.
Vice Chair votes aye. Councilmember Hauser. Councilmember Hauser.
Sorry, I was having a challenge with the mute. Aye.
And Councilmember Taylor, are you still on the call?
Aye.
The vote is 8-4-0 against. So the bill as substituted passes. We now are going to hear from Mary Falls from the administration about, as Councilmember Taylor said previously, to give us some information and answer some questions regarding the request for quotations for the Knowles Assisted Living and Adult Daycare Service. The contract for the current operator is expiring in June 2021, and we would like to have these questions and information before the expiration of this contract so that we don't find ourselves in the same situation that we found ourselves in with the Bordeaux Long-Term Care Center. Ms. Falls, are you on the call?
I am.
Would you like to bring us up to date on what is happening in this process?
Sure. Thank you. Thank you for the invitation, and thank you to Councilmember Taylor as well. Let me I was asked to do 2 to 3 minutes, so I'll give you a quick overview in case not everybody's familiar with the facility. The facility was built in 1990. It provides assisted living and adult daycare. It's licensed for 100. The capacity, the census right now is around 53. A year ago, before COVID, they were at 74. They had their last survey by the state in October of 2019. The facility has about 53,000 square feet. General Services went out and did a review, an assessment of that in the last couple of weeks, and we've just gotten that assessment in. And they have advised us that there are about $777,000 in what they call emergency or urgent needs to be addressed there. That would include a new generator for air handling units, water heater, and so on. There's new boilers out there in the last several years, so those don't need to be replaced. There's about $360,000 currently available to take care of a portion of those improvements, and then the balance will be requested from 4% funds. The current operator is Anthem Care. They took over in a distress situation in January of 2017. They're based out of St. Louis. They want to continue, they plan on bidding. Anyway, so they're still in the picture, fortunately. And then I thought I pulled together, if it's of interest to you all, so there were some questions, I think, about the subsidy, and do you want me to get into that?
Yes, please. That would be great.
Okay. So originally the Metro was subsidizing about, and I say originally back with Anthem Care, about $1.5 million. It's currently the budgeted amount is $2 million in the current budget. The burn rate right now is above that. It's about 2.1 million. This is what's called a blank check contract, where Metro is on the hook for 100% of the losses. So to the extent it exceeds that budgeted amount, Metro is responsible for that. The subsidy per patient, or excuse me, per resident currently is just under $3,300 per patient. All of the patients there at the moment, with one exception, do have some form of payment. Medicaid, VA, just to be clear, those payment sources are not necessarily adequate. It doesn't necessarily cover all the costs of care, but it's a substantial subsidy per patient right now. When the census was at 74 a year ago, the subsidy was $2,200, just over $2,200 per patient. The current census, or at least at the end of December, about 36% were from zip code 37218 and the contiguous zip codes, and 20% of the residents were from out of county or out of state. I got lots of other data, but that's a quick overview, and hopefully I stayed within my 2 to 3 minutes.
You did. Thank you very much. I have a question. Could you explain what does it mean when someone takes over a facility in a distress situation?
That's not a term of art. That's not a term of art. So in this case, it was the facility. The state of Tennessee had intervened because of concerns for patient safety with the previous operator, and there was a challenge to find a new operator.
Would the $770,000 worth of repairs that your audit found be related to some of those things that impacted negatively patient care back in 2017? Are these the same issues, or are they two separate issues?
I think they're separate issues. I think these relate to the structure. I think there were some, they're pending charges. I think the others had to do with the operations.
The actual operations. Do we have questions for Ms. Falls about the Knowles situation? Councilmember Glover. You're recognized.
Yeah, thank you. I guess I'm a little confused on if we've got that many patients or that many residents that are on Medicaid. Why is Medicaid between? I'm confused on why it's not covering 100% of the cost, and why are we having to pick up $3,300, I guess, annually of that cost?
I'm not sure I'm understanding. So the question is, why is Medicaid pay so little?
No, I'm familiar with Medicaid. It's part of what I do in my day job. It's just I'm confused as to why it's not covering 100% of the cost of the residents who are dual eligible, Medicare, Medicaid, or just straight QMB.
Yeah, I can't speak to that. I can speak to the facts that I know. I think it's an important question.
I would like us to find out, because that's just it's just one of curiosity. I don't really know of other facilities in town that get subsidized that have, fully qualified residents that are full Medicaid residents. So it's just more of curiosity than anything. I find it somewhat astonishing that we're having to supplement some of that.
Councilmember Glover, we have done a little bit of comparative research, and maybe this will partly address your concern. Just anecdotally, calling some other facilities in the area, the average cost per patient or per resident varied between $2,000 and $2,500 per patient per month. And those facilities also had some residents who paid at a higher rate. They might have had a bigger apartment or room or so on. So there is that delta that you're noting. But even that $2,000 a month that was the starting rate at some others in the area, it exceeds what Medicaid pays. Medicaid pays about $1,100 a month, I'm told, and So there is a delta between that and what the lowest rate charged by other competitors is.
Okay. The $1,100 a month sounds more like the VA aid and attendance, but I mean, I don't know, but just out of curiosity, I would like to understand that.
I'm happy to ask the current operator what their explanation is.
All right. Thank you, Chair.
Thank you. Councilmember Benedict.
Thank you, Vice Chair. So thank you, Ms. Falls, for being here and for the good presentation. I just want to make sure, I was wrapping up on the Public Works Committee with regards to a couple of very important bills. I see Councilmember Johnston on the call. She was very well aware of the work we were doing over there. So I didn't quite catch your entire piece. That's my fault, not yours. I just want to make sure I understand. You mentioned, could you confirm how many licensed beds do we hold for that facility, for the Knowles facility?
100.
Okay, and so this does not change anything in regard. So even though the census, which means the number of patients in the facility who are currently being taken care of, cared for, that regardless of that, we hold 100 bed licenses, and this does not change that. In fact, this may protect that into the foreseeable future. Is that correct?
I didn't totally understand about the protecting it, but it's 100 either way, whether the census is 15 or 99, we still have a license for 100.
Thank you. I meant from a protection perspective that the council will be involved before any additional decisions are made about these, which much like with, anyway.
Oh, yeah, the asset will, that's an asset that will always be protected. I follow you, sorry.
Got it. Thank you. And then I just wanted to confirm the numbers you were just speaking about with Councilmember Glover. So the $2,000 to $2,500 per month that we typically, or that you refer to that, I believe, as other facilities around the county, perhaps, or the city or the region. Is that what was that number?
That was an anecdotal. We just called several nearby assisted living facilities that had nice reviews. That's at the low end.
Is that, I'm sorry to interrupt there. That's a Medicaid reimbursement number?
No,
okay.
If you call and say, you know, I need a place for my mother, what do you charge? This is what they charge. And I talked to the administrators of some facilities myself. Some start, you know, $3,000 or $3,200, but there are other facilities nearby that $2,000 or $2,500, but that's at the lower cost end.
Okay.
So Medicaid is not adequate at all.
I'm sorry, can you confirm that? I'm not sure I followed that.
In other words, Medicaid is going to pay the same amount regardless of whether you're going to a $3,200 a month facility or a $2,000 a month facility. Reimbursement rate is the same, unlike a hospital that can fluctuate based on the facility you go to. It won't change.
And thank you for that. And for the folks that are out of city or out of the state, you said about 20% of the current residents are out of city or out of state. And of course, we're getting the same reimbursement, I suppose, from Medicaid that you just referenced, right? It is what it is, that reimbursement rate. So are you saying that Nashville taxpayers are subsidizing those out of county and out of state people? Why are we taking those in?
Because, that's the contract that exists right now with the current operator. I mentioned at the beginning and you missed it.
That's probably where I missed. Yeah, sorry.
I'm sorry. This is what's called a blank check contract.
Right.
We have to pay whatever the costs are that isn't covered by the revenue that they bring in. And so the contract doesn't specify that all the patients have to be from Davidson County or that the patients who are subsidized have to be from Davidson County. It's not in the contract.
Could I make the assumption, I think there, with 40 of us being close to 18 to 20,000 people in our districts, I guess I could almost I could definitely talk to my constituents to understand this, but I could almost wager that 700,000 Nashvillians don't like to subsidize folks from out of county or out of state. We're seeing that relative to vaccinations, relative to COVID testing. And you know, we want to make sure that Nashvillians are getting that those who are taking care of us are getting the tax revenue that is being collected here. What can we do in the new RFQ to ensure that any money that Metro is paying to the vendor here is not utilized for those folks from out of state or out of county?
We have a lot of options, and I think the input from this committee is really important to hear how you want to handle it. For example, there are a number of ways. So you could say we will subsidize. If this is where you want to go, you could say, you can 85% of the residents there need to be from Davidson County. You could say if there is a subsidy, the subsidy is only for people who have lived in Davidson County 1 year prior to the date of admission. You could say that if to the extent there's a subsidy, the subsidy is only for the difference between the actual receipts that people have from third-party sources and an average in the county of what other facilities charge. So there are any number of ways to address the concern you're raising, which is a concern we have. Taxpayers should be paying for indigent care for people who are from Davidson County. I don't think there's any concern about that. The question is, who's getting that, and then what is the amount of the subsidy? Is it tailored to the actual need? And again, I don't want to disparage the current contract because Metro was in a bind when that contract was entered.
Well, and I certainly don't want to speak to let me back up. I want to make sure that council's engaged with this going forward and making sure that we don't end up in a situation where we're on our heels about needing to make decisions, or perhaps decisions having been made without the input that I believe this council wants to have relative to indigent care, relative to making sure that no one, making sure that we are taking care of, that government is doing what government's function is, which is to take care of our society, right? So I guess going back to that, is there a reason why we've allowed these folks from out of state or out of county to come in today? Is that the reason why? Is because we were in a bind and needed to just sign the contract, or what? How did these folks end up there? Were they Nashvillians? Like, again, maybe it's a good thing that we have folks from out of state or out of county. To me, that sounds peculiar. So I'd just like to understand how we got here, and then where do we go from here? Do we just, I certainly don't want us to kick those folks to the curb just because they're not Nashvillians, right? They've lived here long enough now, they're Nashvillians. But how do we prevent using Nashvillians' taxpayer dollars to subsidize someone who is not, a part of having paid into that system, for instance, paid into the coffers, for instance?
Right, and
I guess, yeah, the question is, how did we get here, and how do we prevent that going forward? I think you've talked a little bit about how we prevent that going forward, or how we adjust that going forward. Mm-hmm. But how did we get to this point is the question. What can we learn?
Vice Chair, can I help with this?
Mm-hmm.
Yes.
Sorry, Ms. Fall. I'm going to jump in because I was involved in this when this originally happened. If you go back to when this occurred, we were supposedly getting out of the business, and it wasn't going to cost us anything. That's not what ended up happening. And here's the progression of where we were, or where we were to where we are. The other situation that has occurred is over the last 5 years, especially in the Medicaid and the VA business, on the way they actually do their allocations and what they pay for and how they pay. That's changed pretty drastically over the last 5-year period also. And I don't remember the exact length of this contract, but I believe this was done in 14 or 15, one. And Mary, you may be able to tell me that originally, but it's somewhere in that range, I believe, is when this all took place. And that's, my guess is, Council Lady Benedict, that's what occurred. That's kind of what I remember of it, is that's what it was. And we were kind of in a predicament to move, and supposedly we were getting out of the business, but as you see, we didn't get out of the business. So anyway, thank you, Chair. I didn't mean to jump in on you, but I felt like I might be able to give a little history that others didn't have.
Thank you, council member. And I think that again, I'm not suggesting that it's bad that we have folks from out of state or out of county. I'm looking for an understanding. Vice Chair, that's all I've got. Thank you so much again for being here, Ms. Falls, and thank you, Vice Chair.
Thank you, Ms. Benedict. Councilmember Hurt, you're recognized.
Thank you, Madam Vice Chair. Thank you, Ms. Falls, for your presentation. My question is the subsidy, is it reduced over the last, I'm not sure how much it is, and if this is a reduction over the last couple of 2-3 years?
Thank you. It's not a reduction. The contract, the subsidy in 2017, when this contract was entered into, and I'm sorry, can I pause and just quickly back up to Council Member Glover? He was here and I wasn't in any of this. But in 2014, there was a contract that was entered into with a different operator, not this one.
Okay.
And there were substantial challenges with the quality of care to patients. The state stepped in, and this current operator was brought in to stabilize operations. So I want to be clear.
There were a number of irregularities, if I remember. I think so. The original contract was, I think, in 14.
It was in
right,
14.
17. Okay, sorry, Chair.
And so the subsidy for this operator starting in 17, the budgeted subsidy was $1.5 million. It's the subsidy in the current budget, Councilmember Hurt, is $2 million. The burn rate on that is exceeding, it's already at 2.1 million. And I explained, you were on the other committee call. So the current subsidy is 2.1 million to date. Since it's a blank check contract, we don't have better numbers than that, but it is exceeding the budgeted allocation so far.
So, what's the long-term plan? What do you see? Do you see this facility closing in the near future?
No, I hope not. So I think what you're getting at is who would bid on this facility. Anthem Care is interested in continuing. They're interested in participating in the RFQ, so that's wonderful. And then we are going to be reaching out any day now. I think we should on Friday have from the state sending out just a heads up to all of the assisted living facilities in Davidson County and the contiguous counties that this is coming, and encouraging them to register with iBid. And then obviously we'll let them know once the bid is public, once the RFQ is published. I think also maybe getting at your concern, it's my understanding that the assisted living business, while challenged during COVID, is not as distressed as the skilled nursing business is. So they seem to be hanging in there, the assisted living facilities.
So does NOS have a hospital that they deal with their residents, or a specialty hospital to address some of the specific needs?
I don't know the answer to that. I know they obviously have a physician who takes care of patients, but I don't know if there's a hospital relationship.
That would be interesting to know. I'd like to find out if you
Sure.
could.
Yeah, happy to.
Thank you.
Thank you, Councilmember Hurt. Councilmember Hauser, you're recognized.
Thank you. The question that I have, if I'm understanding what you're saying, is basically we were presented with the bill. This is how much it costs us to run this month. This is how much we received in income. Metro pays the difference. Is that correct?
Yes.
Okay, then the next question I have is in relationship to industry standards and other facilities. Because on the surface, and I'm not implying there's anything wrong, it's just that on the surface, it would appear to not have any kind of incentives to basically hold your belt in. It kind of seems like whatever you do, we'll pay for it, whether it's economical or the best practice or not. And that may not be true, but it could be. So I'm wondering if there's any kind of provision in the contract, or have we ever had anything that related, it takes X dollars in this facility, in a very comparable facility of similar size, similar population, it takes X plus or minus dollars. Is there any kind of comparison of that nature?
There's not in the current agreement. The RFQ that's going out, attached to the RFQ will be a draft, a lease and operating agreement, just like we had with Bordeaux. There was a draft agreement attached to it. And in the draft we're working on right now, there will be guardrails addressing what you're bringing up and what your colleagues have brought up. We have the benefit of not being in the circumstance that Metro was in 2017, where they were really in a bind and had to make a change very quickly.
Okay, great. But that is mainly the thing I wanted to look at, is that we aren't just carte blank check, but that there is some recognition. And not that we want to cut services. I don't imply that. I certainly don't want to have poor quality anything for our residents. But I also want to make sure that we're getting the value for the dollar we're spending. Thank you.
And to that point, the two sort of guideposts that we are relying on are the same guideposts we had for Bordeaux. One is that bidders have to have a demonstrated track record of providing high quality care. And two, they have to have demonstrate the financial wherewithal to provide that care, so that we don't end up in the same situation that we were in 2017, when there was an operator that didn't provide quality of care and also didn't have the resources to do that, and the patients were suffering.
Does that answer your question, Councilmember Hauser?
Yes, it did. Thank you.
Thank you. Councilmember Hurt, you're recognized.
Thank you. You know, her questions kind of piqued my brain some. So what if someone else comes in and gives a better bid? Would we really consider bringing those individuals in? And the reason why I ask that is because if we brought them in because they gave a reduced rate and there would not be a loss and we wouldn't have to subsidize it, but once they got in, they found out it was going to cost them much more than what we thought. And at that point, we would already be in this agreement. Is that a possible scenario to consider?
Yeah, and you and I had that conversation last summer. I mean, that's a risk, right? You don't want someone to come in and lowball or make overly rosy projections. So that's why really having the proven track record is critical. We don't want to we don't want this to be the first shot of an operator. So looking at their track record, they have to provide financials to us. They'll have to provide, there'll be background checks on the people who are, and that's part of the procurement process in a high-risk contract, and this is a high-risk contract. All those guardrails are really important to protect against that, exactly what you're identifying.
Okay. I just don't want to see, while things are going well with Anthem, what it is that they're doing and how they have stabilized things, that someone else comes in and they have the credibility and the forecasting and all of that. But it's different once they get on the inside and see just how complicated or how costly things are. And just want to make sure that we are doing everything possible to have some consistency and operate in the best possible way that we can.
Great.
Thank you, Councilmember. Councilmember Hall, you're recognized.
Actually, Chair, the two questions or two things that we're going to bring up have already come out or been addressed, but I think we're on the right path. It has been a tumultuous process leading up to this point. I'm sure everyone now is aware of the recent history of the facility, and for a group to come in and take it from 147 pages of deficiencies to 0 and be working toward not needing a subsidy at all. I think we've made great strides and improvements in the conversation and process. And so I echo Councilmember Hurt in not wanting to see the care and quality of that care or the community participation suffer by bringing in another entity that can't reach the same standard that now has been set. And so I think this process has got us going in the right direction. And I look forward to seeing who all wants to bid, who all wants to participate.
What is it? Thank you, Councilmember Hall. I don't see any more hands or any more questions. Ms. Falls, thank you very much for giving us your time this evening to answer questions. I am sure that we will have more questions as this process moves forward and we put out the RFQ. No other questions? I think that this meeting of Health and Hospital is adjourned. Thank you all so much.